Good morning. The topic for today will be legal aspects of nursing. Okay, so we'll be discussing about the legalities of your nursing profession. Okay, so those things that you need to know, okay, in order to protect your hard-earned license. Okay. Okay, so how do they regulate the nursing practice in the United States? Okay, so number one, okay, number one is through your Nurse Practice Act. Okay, okay, when you say act, okay, it's a law. Okay, okay, so it defines the reasonable care in each state. Okay, so the Nurse Practice Act is enacted by each state in the United States. So there are about 50 states. So each state has its own Nurse Practice Act. Okay, to regulate the practice of nursing in that particular state. Okay, so what is included in the Nurse Practice Act? Okay, it covers number one, okay, the educational requirements. Okay, so you need to finish subjects in school before you can practice as a nurse. Okay, number two, the scope of the nursing practice. Okay, so what are the things that nurses can perform or do? What are those things that you cannot do? Okay, number three, licensure requirements. Okay, so these are your NCLEX, NCLEX. Okay, number four, it also includes the rights of nurses. Okay, what are your rights as a nurse? Okay, so it's not only the patient have rights. Okay, and lastly, number five, grounds for disciplinary action. Okay, what do you mean by this one? Okay, so if the nurse commits an error, okay, or a mistake in your job, okay, you will need to be punished. Okay, so we call it disciplinary action. Okay, so nurses are the ones responsible for knowing the provisions of the act for the state in which he or she works. So it's your responsibility, okay, to read the law, okay, before you work as a nurse in that state. Okay. Okay. Number two, okay. Okay, another way of regulating your nursing profession, okay, is through the standards of care. Okay. What are standards of care? Okay. These are guidelines. Okay, when we say guidelines, these are rules. Okay, describing the skills and the learning that nurses should possess, okay, to ensure high quality care for your patients. Okay, so the standards of care, okay, are also used to evaluate the quality of care provided by the nurses. Okay, to determine whether nurses have performed their duties in the appropriate manner. Okay, because if not, this can be put into a legal issue or legal action by the patient. Okay,